Hi Russ, good afternoon.
Kevin, the NHS is constantly getting some negative attention from the media, and this makes patients very worried about the NHS. And in particular, I've had a letter in from a lady who thinks that the NHS won't be around for much longer. What would you say to that lady?
Well, I think we should have a tremendous confidence in the NHS. It is fair to say that we are under pressure. We've got an ageing population, we've got population that have increasing needs of the NHS, and clearly there are budgetary pressures. There's also workforce pressures, but the NHS is something that's really precious, something we should all fight for very dearly, and I think it's in a good place. In spite of some of the things we don't get right, the vast majority of patients are treated safe, personally and effective, and I think it's something to cherish the NHS.
In a speech on Thursday, Health Secretary Jeremy Hunt sent a message to NHS Trust that improvements had to be made in meeting the national target of seeing 95% of patients within 4 hours of them being admitted into A&E departments. Now, as you and I have previously reported, this aim has been missed in England since July 2015, and it fell to a record low of 85.1% in January of this year. That's in England. But achieving it is absolutely critical to patient safety, according to the Health Secretary. So let's talk targets. Are you meeting your 4-hour target?
So over the last few months, we've not met the A&E 4-hour target. It's been incredibly pressurised because of the numbers that have been coming into our A&E department, but also how poorly the people actually are when they've come into the department. So we've not met that target. But I would agree, we have to do everything that we can, and we have to strive day in, day out to deliver that target. We are putting a lot of improvements in. I'm pleased to say that last week our performance was much better, and we just have to take it day by day, do everything that we can to achieve the target and improve our performance.
Well, reaching hospital performance targets has been described as a mission impossible. This is coming from NHS providers in a report that they've released today. And as the organisation also called for realism, flexibility and support in the NHS's approach to performance figures. Now, NHS providers found that targets for 2017-18 are out of reach for the health service, as it revealed there was an increasingly unbridgeable gap opening up between targets and low levels of funding. What are your thoughts on that?
So my job is to try and balance this equation between quality of what we do, between the money we have available, and between performance targets. And it is a very difficult task that we have, because we have more people wanting to access our services. We have increasing demands in terms of expectations of the public, and that's quite right. We have pressures in terms of workforce shortages, and there are times when money is tight. However, it doesn't mean it's not achievable. It just means that I think we're going to have to work differently in the future. So if you look at how we're performing as an organisation, I'm really pleased at where we currently are. So we're hitting virtually all of our quality targets. Our money, whilst money is tight, we're hitting all our financial targets. We're hitting most of our performance targets, with the exception of, we've already discussed, of A&E. So if we can get A&E to where it needs to be, we will be performing against the vast majority of quality, money and performance targets, which is a good place to be. And actually we're doing far better than the vast majority of other NHS trusts. But it will be tough next year. It will be incredibly tough next year. But my job is to do the best that we possibly can to hit all three of those.
The NHS will not solve the problem of reliance on agency staff until it solves its wider workforce planning issues. This is according to a Public Accounts Committee report. In the committee's latest report, it was noted that NHS acute trusts, like the one here at the Royal Blackburn, spending on temporary staff increased by 24% between 2012-13 and 2014-15. as a result of difficulties recruiting permanent staff and new requirements for safe staffing levels, which of course cause all sorts of problems. During the inquiry into NHS financial sustainability, NHS England said that spending on temporary staff was also the largest driver behind trusts' increasing deficits. So, Kevin, are you still having to rely heavily on the use of agency staff, and is this the single biggest issue that affects your finances?
So as I said, our finances are under control and we're in a good place in terms of our finances. We're hitting all our financial control totals, and I have no real concerns about the financial viability of the organisation. Having said that, we do incur a lot of costs for agency staff. Every trust in the country does. If you think about some of the problems that we all face around recruitment, they are big structural problems, because if you think about consultant staff, actually to train and then get experienced consultant staff, you're talking between 10 to 15 years to go through that training process. So these are long-term structural issues that we've got, and they will be with us for many, many years. So we're not going to solve it over the next immediately. There will be pressures where we need to employ agency and bank staff. We're trying to do as much as we possibly can to recruit our own staff. So that's where the reputation of the organisation becomes important. That's why it's important that we're seen to be an organisation that supports its staff. That's why we need to be seen as an organisation that's delivering. So it's delivering on quality, it's delivering on money, it's delivering on performance, as we've already talked about, because that allows us to attract the best staff and more staff into East Lancashire. But I do think staffing and agency staff and the use of agency staff is the biggest issue that all large NHS organisations will face over the next few years.
Hospital chief executives are now expected to personally sign off agency shifts costing more than £120 an hour, NHS Improvement has told us. Can you give us some examples, Kevin, of a type of agency worker who might be paid over £120?
So most of those payments would be made to clinical staff, primarily doctors who would work in the accident and emergency department and on some of our busy acute medical wards. So a particular example would be it's 8 o'clock on a Friday evening. It's really busy. We've got a changeover of shift, and we get a short-term vacancy because a doctor phones in sick. The manager who's on call then, or the senior doctor on call then, has a decision to make. Do we allow the shift to go ahead with one doctor down, or do we go to an agency and pay the £120 or whatever the rate will be to try and get somebody in at short notice? And clearly what we'll always do is prioritise safety over anything else, and if the senior person on call or the senior doctor on site thinks that safety would be compromised, we would go out to an agency and we'd have to pay the going rate for that person.
But I think it's important for members of the public to realise that although that figure might be X number of pounds, that the agency gets quite a substantial fee from that amount of money.
No, that's the case, and I would dearly like not to be able to have to rely on agency staffing, unfortunately, because of the workforce shortages across the NHS, and actually because some staff prefer to work on agency basis because it suits their lifestyle. They don't want permanent contracts. There will always be a cohort of staff who will do that. What we're trying to do is to have our own agency staff on our own bank who are not contracted for through the agencies, so you don't get all those overheads. And actually we've had a lot of success with that, particularly for nursing staff now. And more of the nursing staff that we employ on a short-term basis are on our own bank, our own agency, as opposed to going through a commercial company.
STPs, or Sustainability Transformation Programmes, must pass new care tests before closing hospital beds, says NHS Chief Executive Simon Stevens. Hospital bed closures proposed in major service reconfigurations will only be supported in STPs if they meet a new patient care test. Now, a lot of patients have read this and are very worried. Does that mean hospital beds are going to close, Kevin?
Not that I'm aware of. Clearly we have to look at services across Lancashire, and we have to get the right configuration of services across Lancashire. But actually, if you look at the growth in demand in hospitals, I think if we can manage to even just keep the status quo in terms of bed numbers, we'll be doing well. So whilst I don't think anybody could ever say services will not change in future, because they do. If you look at how healthcare is provided now, it's very different to what it was like 10 years ago. And in 10 years' time, it'll look very different to what it looks like now. So healthcare will change, and that's right. But, to say we're going to have large whole-scale service changes and bed closures, I just think is wrong.
Well, I know that since we last spoke, there was a big press around maternity services in Burnley and a lot of confusion around that. Could you sort of throw some light on that for me?
I can't really say where those rumours came from, but what I can say is we have first class women's and children's services. Our maternity services and the neonatal services, etc., are some of the best you will find anywhere. If you take our Burnley, the Lancashire Birthing Centre, we have over 6,500 births. It's inconceivable that we would not have a neonatal unit level 3 on that site to support that level of birth. So I cannot see any changes to those services. In fact, those services are very well regarded, and I can only see them growing and developing.
North Cumbria University Hospitals Trust and Cumbria Partnership Foundation Trust could set up a joint leadership team. The move could form part of the region's sustainability and transformation plan. But is it possible we could see something similar, a joint team formed of trusts in Lancashire, including yours?
So we're already trying to work better together as providers across Lancashire, and I think that's working well because some of our services are interdependent. But I think more and more what you'll see is within Pennine Lancashire, commissioners and providers coming together, health and social care coming together to try and break down the barriers between the different organisations and the different services, and I think that's the right way forward. So yes, we'll continue to work together as providers across Lancashire, but more and more the work will be within Pennine Lancashire.
National NHS leaders have set out estimates for how many beds individual trusts should be able to free up by working with local authorities on how to use the $2 billion of extra social care funding announced in the budget. I'm laughing because I don't think it'll happen. But NHS Improvement set out the estimates in a letter that urged every provider to actively engage with social care colleagues as a matter of urgency. Kevin, how would you like to see this additional funding best used across Lancashire?
So I'm very clear on this, that the additional funding is meant to ease the pressures on delayed transfers of care within the acute sector. So our local authority colleagues, social care colleagues, need to work directly with myself and my team to be able to see which schemes will have the biggest impact, because we know at any one point in time there are up to 100 patients or so across our hospital bed base who, with different facilities elsewhere, could be nursed or could be taken care of in nursing homes, in their own homes, in other locations. They don't need to be in the acute hospital. If we could get even half of those 100 patients out into a different setting, that would have a massive impact in terms of freeing up beds within the acute hospital, allowing a flow of patients and allowing a much better patient experience and helping the A&E performance. So it's really, really important that social care colleagues and healthcare colleagues work very closely together, and we put schemes in place that's going to dramatically reduce the pressure on the delayed transfers of care in the acute sector. That's my clear understanding of what the additional money has been allocated for, and that's what I will be pushing with social care colleagues.
Has that cohesion got better? Because historically it would be fair of me to say that in the past it seems very much that it's been them and us, and that you haven't worked closely together. Has that massively improved now?
I mean, I've got nothing but admiration for social care colleagues. They work incredibly hard under very difficult circumstances, and I think we work really well now with social care colleagues. A lot of the barriers are coming down, and the teams on the ground, the social work teams on the ground, the hospital teams on the ground, there's no difference between them. They just work together as one team, trying to do what's right for patients and their families.
One of the nice things to have happened lately across East Lancashire is the Nurse of the Year award, which was presented to one of your nurses, Erin Bolton. That's great news, isn't it?
Oh, it's fabulous news, absolutely fabulous news. I mean, Erin is a real model of care and professionalism, and the services that she leads are really, really safe, caring, compassionate, and for her work and the work of her team and services to be recognised, and for her to be recognised as the Nurse of the Year, I think is just fabulous for her, it's fabulous for our services, and it's fabulous for East Lancashire, and it's what I see day in, day out when I go around the organisation and see what goes on. But I'm immensely proud of Erin and all that she does.
And of course, leading on from that, you're continuing to run your Employee of the Month award, which this month, or for last month, which February, of course, has gone to hospital porter Ismail Bamji. That's great news, isn't it? He's raised a lot of money.
It has raised a lot of money. So the Employee of the Month, we give every month an employee an award, and it's nominated by their colleagues, and it's meant to recognise somebody who just goes that little bit extra and does that little bit extra over and above what would be expected. And every month it's incredibly difficult to judge because we have so many staff, clinical staff, support staff, who are nominated. This month it was Ismail. He was nominated for raising nearly £14,000 worth of income, and that was used to buy additional facilities for our stroke wards, both on this site and over on the Pendle site.
So congratulations to him, and also congratulations to you, Kevin. You've been recognised as one of the top 50 chief executives in a list of NHS leaders selected by the country's largest specialist healthcare magazine, the Health Service Journal. And that also is fantastic news, so congratulations for that.
No, thank you. And I think it's a reflection of just where East Lancs Hospitals Trust is now. I think we're recognised as being a really top hospital and community provider. It's not always been the case, but I think over the last few years people have recognised how well we're doing, and that's really, really important because we need to gain the confidence of our local community. We need to improve the services going forward, and we need, as I said before, we need to attract the best staff possible. So things such as Chief Executive of the Year or in the top 50 of the Chief Executives, I think it's important because it places East Lancashire Hospitals Trust in the right position.
And of course you mentioned the fact that there are a lot of good things happening across the Trust, and one of those is the staff satisfaction survey, which has had some very good results.
It does. This is a survey that takes place every year across all NHS organisations, and it is viewed, I think, by most seasoned commentators as probably the most important indicator of how an organisation is doing, because staff are very open and very candid, and if they're not saying good things about their own organisation, well, actually, it's a real reflection. It's telling you something. And historically, we've always been in the bottom 25% of what staff have been saying about their own organisation. But over the last 2 years, our performance has been excellent. Last year, we were in the top 25%. And indeed, this year, we're in the top 3 in the country in terms of what staff are saying about their own organisation. Everything isn't right, and there's still things that we need to improve, but the fact that staff are saying it, they want to work here, they would bring their families to be treated in here, they can deliver safe, personal, effective care, I think that's really, really important. And of all the things and all the accolades that we've talked about, I think the staff satisfaction survey is the one that I'm most proud of.
And I know it's a cliche, but it's not rocket science. Happy staff equal happy patients. So congratulations, Kevin, to you and your staff on those survey results. And it's time for me to go. Just to remind you that you can write into the address at the end of this presentation. In the meantime, Kevin McGee, thank you very much for talking to us.
Thank you, Russ.